to go on YouTube, what do we type on YouTube?
I will show you. It's MedSapient. It's MedSapient 247. So go to YouTube.
Okay.
MedSapient 247.
Okay.
All right. So that's this is
yesterday beside the exam, what did we do?
We'll cover some of it now. So this is let me share my screen. So this is what's happening on YouTube now. Okay. Sorry. All right. So this is on YouTube, but it's not public. So it's not that everyone is seeing you. Okay. It's not public. Okay. All right. So let's continue. Oh no, I didn't share it. Okay. This is what's happening on YouTube.
Oh. Okay, but how do I search for it?
If you go to MedSapient, to go to YouTube.
Oh yeah.
But you don't have to look for it now. We'll figure it out later. Okay?
Okay.
All right, so let's look at what we are doing today. Interpreting skills. So this is our work for today. Communication. So it's 6:50.
That's not related to the class. Because excuse me?
This is the topic for today.
No, I know. Because I'm on my phone and my laptop. Because on my laptop the sound is really low. Okay. There's no way I could have both of them connected without having any interference. So I'll be wider.
So you turn off this, since the sound is poor on your on your laptop, turn off the sound on your laptop.
Okay. So I'll be connected on two things.
Yes. Just turn off the sound on your laptop so there's no reverb.
Okay.
So today we are looking at what is communication. So we're looking at interpreter skills and protocols, okay? And for us to get there, we have to look at what is communication, okay? Why do people communicate? How do people communicate? What is the role of the medical interpreter, and what is the process of communication? Okay, and then we're looking at what actually happens in an interpreting session. All right. So we went through some of this yesterday, so we're just going to run through it, and let's go on because of time. We're looking at concepts and terms in communication. Okay, we have so in communication there's a sender who has something they want to send. They encode it. It becomes a message. They choose a channel and they send it, and the receiver decodes it, and so this is the process of communication. So the receiver is the person who the message is intended for. Okay. The message is the particular meaning or content the sender wishes the receiver to understand. Noise is anything that interferes with the sending or receiving of a message. There's external noise and there's internal noise. Okay. External noise being noise from outside, internal noise being internal distraction. Maybe your thoughts are somewhere else. Okay, your thoughts are somewhere else. We call that internal noise. You have to look at, so we talked about stereotypes, something we talked about stereotype yesterday. So a stereotype may be people who live in Miami like going to the beach. Okay, but you might find someone who lives in Miami who hates going to the beach. Okay, a stereotype is, for example, di mun akaireme banan. Okay, ukavin well gen mun ki sot akaye ki pareme banan. Ou bien si di oh j'ai aimé yore tom tom avec kalalou. Ok, mais ou kavin well mun ki sot Jérémy ki ray tom tom. Okay. So that's stereotype. Okay. Prejudice is negative feelings or attitude towards people based on identity or identities. So of course we understand what prejudice is, right? There's prejudice against people of Haitian descent. Now, while some of us may think it's only the people in what's it called now, in Springfield who are affected, the fact is that every person who is from, whether you live in Springfield or not, you are affected. So that is a prejudice against people from Haiti, right? Based on
Sorry.
Yeah. Okay, so based on a lie. Okay. Slang refers to a new or adapted word that are specific to a group, context, or time period. Can you think of any slang? Haitian slang? Can you think of any slang?
Yes, we have some.
For example?
When if you hear Haitian say Babylon. Babylon mean for gangster, it's la police.
Okay. 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 All right. That's good. Okay. Any other slang you know? What is acheter figi?
Acheter figi mean like you
C'est pas ça le dit?
C'est ça?
Soussou?
Comment?
Soussou.
Okay. Okay. What else? Stanley, no ideas?
it
means to bribe somebody. Bribe somebody.
Yeah.
Bribe. Okay. So anyway, so that's slang. What about jargon? What's jargon?
Jargon.
On parle pas comment on va comprendre.
Okay. All right. That's correct.
Like ou ka tande Haitien dit enlagé.
Okay, what does that mean?
Canale.
Canale.
Okay. All right. So so anyway, those are some terms. Now, yesterday we talked about affect. Affect. Okay. Affect is how somebody looks like. Okay. Your affect could be sad. It could be happy. It's the appearance, your appearance. That's your affect. What you look like.
Yeah.
Okay. That's your affect. Okay. So affect is the attitude or emotion a person brings to an utterance. Let me make this big. Can you see my screen?
I can see on my phone, not on the laptop. It's very small.
So Joanne, so on your laptop, you should actually disconnect. Okay, well, let's keep going. So anyway, so let's look at this affect. I don't want to waste too much and we have a lot to do. Affect is, can be conveyed through your facial expression, your intonation, your gestures, or what they call paralinguistic mechanisms. Okay, I don't want to waste too much time. Your vocal characteristics, it could be loud, it could be low pitch, your rate. Okay. Affect could also be a question of your facial expressions. Okay. Affect could also be your gestures. So if I do this, it means I don't know.
Yeah.
Okay. Or do you know what this means?
I don't know. I don't mind.
Okay. All right. Body language. Okay. Your body language is when you use your physical activity to communicate intentions or sentiments. Okay. So if you are smiling, as if you are frowning, so all of those things. Okay. So that is affect. Affect, you can communicate affect either through your whole body communicates your affect. So let's just move on about affect. Do you understand what affect is? Do you understand what affect is? You have to respond yes or no. It's a question.
Yes, yes.
Okay. Steve, do you understand what affect is? Yes or no?
Yes, sir.
Okay. All right. Please, if I ask a question, just respond, then we can move ahead, because otherwise I have to stop and, because I'm trying to make sure you understand. Okay. So let's go on. So there are different ways of showing your affect. Okay. It could be by let's look at this. There are verbal and non-verbal ways of showing emotion, okay, such as through facial expression, your body language, your tone of voice, laughing, crying, smiling. Those are all ways of showing your affect, okay? For example, when you say vocal characteristics, for example, a forceful tone, I can show you what I feel. If I say, I really need you to stop now, right? I'm showing you by my tone of voice that I'm getting angry, or I'm getting upset, or I'm, but if I said, I really need you to stop now.
Yeah, it's
different, right? So I'm showing you I'm saying the same words, but the way I'm saying it,
two different tones.
Yes, two different tones. Okay, good. So we talked about tone of voice, volume, rate of speech. Okay. With tone, we express our emotions and attitudes. We convey meaning and intention, okay, and things like that. So one thing that's important in communication is the affect. The other thing that's important is the context. Okay, context. Okay. And context is the way the meaning of the message is influenced by the circumstances surrounding it. Okay? If if you call me at 2 a.m. I'm going to say, goodness, why are you calling me at this time? Right? If you call me at 2 p.m., so it's 2, one is a.m., one is p.m. The phone call is from Stanley, same person. Stanley calls me at 2 p.m. and I say, Sakpa Seapa. Right? So the context has changed the way I respond to Stanley. Okay? So, so context affects meaning. Okay?
And then the call at 2 a.m. You can answer the same way, but with different tone.
Yeah.
So you can say Sakpasi for 2 p.m. and 2 a.m., but Sakpasi at 2 a.m. with a different tone have different meaning.
Yeah. Exactly.
The 2 a.m. would be anxious.
Yes, the tone may be anxious or irritated.
Yes.
Right? Yeah. And the same Sakpasi, can be simply, Sakpasi, like, what's up? What's happening? What's up? Or
what's up?
Or it could be anxious, Sakpasi.
Why you call me? This Sakpasi at 2 a.m. mean, why you call me at this time?
Yeah. Okay, so so we understand context. Okay, context changes meaning. All right.
Yeah.
So we have to note the context. What is happening. If if they are trying to if somebody is unconscious and they're trying to wake him up, right? They will be saying, they might be saying, Steve, loud.
Yeah.
But if Steve is awake and fully and you are screaming his name, so context affects meaning. Okay. So affect context. And then the third thing is the third thing we want to note in communication, we is register. There was questions about register in the last test. Okay.
Yeah.
So register is the level of formality. Okay. The level of formality of a language. So the way you will speak to your teacher is different, when you were in high school, for example, the way you speak to your directrice will be a director. It's different from the way you speak to your classmates.
Yeah.
All right. So, you might be saying the same thing, but one, it will be formal and the other will be, not so formal, right? The way you speak to your best friend is different from the way you speak to somebody you are just meeting. Okay. So register, it talks about the level of formality. Okay. Level of formality. Okay. So in any language, there are various ways to express an idea depending on the desired level of formality or informality. Let's make this bigger. So, so in any language, there are various ways to express an idea depending on the desired level of formality or informality. These differences are known as language register or linguistic style levels. The choice of register often reflects the speaker's relationship with the listener. Okay. Let me see. Give me a second here. Let me add something else there. So for example, okay. So for example, people speak differently when talking with a parent, teacher, or close friend. Okay. So another term for this degree of familiarity is called social distance. So what is social distance? Social distance refers to the perceived closeness or distance between individuals. People may adjust their language style to match the social level, the desired level of social distance. For example, a person might use a more formal register when speaking to a teacher, but a more informal register when talking to a friend. As a medical interpreter, it's essential to use the same register as the speaker to avoid misunderstandings.
So whatever the person says, you use it.
Yes. So remember, it's not just what they say, but how they say it. So if they use the formal register, you use the formal register. So remember that to be accurate, you have to represent what the speaker completely. Okay? Both what they said and how they said it. All right?
Yes.
To be accurate.
That's when, in one word, we can say you have to stay at the same level
Yes.
with the
Yes.
speaker.
Same level, register level as the speaker, same level. That's correct. So by understanding language registers and their relationship to social distance, you can ensure that your interpretation accurately convey the speaker's intended meaning and maintain the appropriate level of formality or informality. So for example, high register, the patient is exhibiting signs of tachypnea and dyspnea. All right. Okay. Medium register, the patient is breathing fast and having trouble catching their breath. Low register, they are having a hard time breathing. Okay. The same thing said in 3 different ways. So this one is high register, medium register, low register. So now let's look at formal and informal. Okay. Formal register, the patient's condition has deteriorated. Informal, things are getting worse. Intimate, honey, I'm worried about you. Okay, so so these are different registers for saying the same thing. Okay, so there is
These sentences are like example, right?
yes, these are examples. These are examples. Okay. All right. Somebody driving a motorbike. Okay. So now, why do people communicate? Okay, people communicate for a number of reasons. You can look at the reasons. We won't go through them. Okay. Build relationship, express feeling, meet needs, share information, collaborate, compromise, console, commend, co-create. Okay. Many reasons why people communicate. So you can read that when you're reading. Won't stay with that. How do people communicate? We've said that they communicate through verbal, spoken. So that is easy. That is, what exactly you are saying. Okay. So these aspects okay, let's make this bigger. So there are many aspects of communication that process that alter the delivery and interpretation of the message. These aspects relate to the language experience of both the sender and receiver, referred to as semantics. People typically make reference to things they are familiar with, including landmarks, popular culture, and slang. Barriers can occur when both parties in the conversation speak the same. Barriers can occur even when both parties in the conversation speak the same language. For example, if you ask a person who has never used the internet to Google it, they would have no idea what that means. I gave the example of, in Nigeria, they say if somebody calls you and hangs up and waiting for you to, because they want you to call them back, we say that they flashed you. Okay? But in America, if someone says they're going to flash you, it's an obscene thing they're saying. We talked about that last week. So how do people communicate? So there's verbal communication, and then there's non-verbal, also referred to as body language. Okay, and it greatly affects communication. Okay, so non-verbal includes body language, facial expressions, tone of voice, and the pace of conversation. Non-verbal can have a tremendous impact on the communication experience and may be much more powerful than the verbal message itself. Okay? You may have previously learned that 80% of communication is non-verbal. The importance of verbal communication, of non-verbal communication. The importance of non-verbal communication during conversation has been broken down further, estimating that 55% of communication is body language, 38% is tone of voice, and 7% is the actual words spoken. Okay? Okay? If the sender or receiver appears disinterested or distracted, the message or interpretation may become distorted or missed. So this is what it is. So 7% is the words you use. 55% is your body language. Okay? 38% is variation in your voice, tone, inflection, volume, pitch. Okay? All right?
Yes.
Okay. So when people talk to us, we absorb a mere 7% of what they are saying through the words they use. We derive 55% of the meaning from their body gestures and posture and physical clues, and 38% from tone and inflection of the words they present. Okay? So let's remember that. Okay, we need to run. So facial expression. So types of nonverbal communication. So there are many. Facial expression, even smell. Okay? If somebody puts on cologne, perfume, they use a deodorant, they're communicating something. Okay? If somebody doesn't care, they haven't showered, no deodorant, they're also communicating something. Okay? So I was bike riding yesterday, and I was bike riding, and then there was a yard sale. I love yard selling. So the yard sale going on, and I rode up to the yard sale, and there was a guy there. He was 6 feet away from me when I smelled him. Okay. So he communicated something to me without speaking to me, his back was to me, without looking at me, right? So communication, even the smell, time. We talked about time. If you call me at 2 a.m. or at 2 p.m., Okay, vocal intonations, body gestures, and haptics. So these are different types of nonverbal communication: facial expression, gestures, vocal intonation, proxemics, which is the closeness, okay, physical closeness. Okay. Silence. Silence is, silence is communication. Okay. Signals and signs. So you can read. I'm not going to go into all this. You have the notes. Read the notes. All right. You can communicate with the eyes, right? If you tell me something and I say, it means I'm surprised. I've communicated with my eyes. Or if I do, I've communicated with my eyes. I've communicated irritation, or I think you're, I think you're talking things, right? No, I don't believe you. So read all of this. These are the various ways we, body body language. Okay, haptics, touch, olfactics, smell, paralanguage. Okay, so I'm not going to go into it. You read it all. It's all there. So communication styles. So this table outlines different aspects of communications. Let me see if I can make this bigger. So it outlines different aspects of communication styles and how they tend to vary across cultures. Being aware of how communication styles tend to vary across cultures can help you avoid misunderstandings. But it's also important that you understand the unique cultural identity and individual preference of those you serve in order to communicate with them effectively. So, so in a culture, there's a, in if somebody is giving directions in a Haitian crowd, they will do this, which means right.
Yeah.
Okay, that is Haitian. No, I haven't seen it done anywhere else. Okay, yeah, so yeah, so generally in a culture, you might find people communicating have a certain style of communication. Okay, but not everybody in that culture necessarily communicates in that way. So while you're understanding how cultures communicate on a general note, you still have to know the person that is across from you. Okay, do you understand?
Yeah.
So that we're not using stereotype.
Could you please repeat?
There are two things. One is understanding how people communicate in a culture generally. Okay, generally. Okay. But it's also important to know how the person across from you communicates as an individual. All right. So do you understand?
I'm trying.
Yeah. A simple thing like Vimpaleo. In English, we don't say, we don't say, come, let me talk to you. In English.
I'm here. Or I need to talk to you.
Well, yeah, but not the same way. Vimpale is, we don't say come here. We go to the person if you want to talk to the person in English. Right? You don't say Vimpale. You go to the person. Okay.
I think so. It's depend the relationship that you have with that person too.
Okay, that's correct. That's correct. Okay. All right. So anyway, so they are called. So let's read these. I won't go into it. So you read these. The cultural differences that in tone and volume and speed of speech, eye contact, the use of pauses and silences, facial expression, emotional expressiveness, self-disclosure, formality, so directness, content, orientation to self or others. So you go through all that yourself. Okay, I won't go into all that. We have to move on. But this is information that's there. You check it out. So factors that influence how a message is given or received. There are many factors. Okay, you have the sender factors. My emotion, my attitude. If I'm stressed, if I'm angry, my cultural background, my language choice. Okay, do I want to express formality, or do I want to express closeness, informality? Okay, do I want to use high register words, or medium register or low register? Okay, and then also my skills at communicating. So for the receiver, perceptions and prior experiences, you can say the same thing. You can say the same thing to two people. One will say liga de mba, liga de mba, but people say that liga de mba.
Yeah.
But comment on fait qu'on aime garder au bas? Ou non j'aime? You understand what I'm saying? So that is
where you're talking to the person.
Come on. Si même si vous respectez, ça parle du garder en bas. C'est ou de respecter. Ce qui veut dire pas au mal élevé, c'est vous même qui mal élevé. Tu comprends? Sous parler mal avec. On va pas dire garder en bas, on va dire mal élevé. Tu comprends? So, ou ka di deux moun même bagay. Youn a konnen ou garder le bas. L'autre moun nan a dit que mon cher, ou mal élevé. OK, même ou de deux moun même bagay. So the point here is that the way someone interprets, or the meaning a person gets from what you say to them depends on what their previous experience. You understand what I'm saying? Do you understand?
Yeah,
I'm trying.
Yeah, it depends on their own context. You comprend? It depends on their context. So the point here is that there are factors that affect communication. There are some sender factors, there are some receiver factors, okay? And then there are some contextual factors, okay? What communication are you using? And this is an important thing for us to remember, power dynamics. I want us to know this, power dynamics, okay? Where's my bold? Power dynamics. Power dynamics refers to the relationship between the sender and receiver that can influence how they. So power dynamics also talks about social standing, right? Social standing. This also refers to social standing. So in a medical encounter, we know that the provider, has more power than the patient.
I suppose, yes.
Yeah. And the interpreter is kind of somewhere in the middle.
Okay.
So in a way. So we call that power dynamics. So how people communicate depends on the power dynamics that exists, okay? Yeah. And then, of course, other factors that influence communication, environmental factors, okay? Like noise, distractions, and things like that, okay? By example, T. Stevens. T. Stevens can parler de là. That's environmental factor. All right.
Steven Ashita today.
Okay, so so bridging the communication, so our role as interpreters is to bridge the communication gap between two people who do not speak the same language. Okay? Right? Who would not speak the same language. Okay? So the
excuse me.
so yes. That's
okay, I'm good now.
Okay.
There was a noise. There was
something
else.
D'accord, merci. So as an interpreter, your role extends simply beyond simply interpreting words. You must make this. Let me actually make this bold. As a medical interpreter, your role extends beyond simply interpreting words. You must accurately convey not only the spoken message, but also the non-verbal cues that contribute to its meaning. This includes tone of voice, facial expression, gestures, and even the significance of silence, which can vary across cultures. Okay? All right. Let me see if I can put this a text box around this.
Yes.
Insert text box.
Now who's next? I want all gospel.
Please. I want to see if I can put a text box around this. Insert text box because I want to put it in the box.
Now, which one of you two is next? Actually, no, you both are solid stall forever. Go home right now, both of you.
Okay, well, never mind. Well, that didn't work. But anyway, what I'm trying to point out is this is very important, okay? So while you strive for accuracy and completeness in your interpretations, it is essential to acknowledge the potential for misunderstanding, okay? Seek feedback from both the clinician and the patient to ensure that the message is being conveyed effectively, okay? And the other thing is that cultural sensitivity is paramount in medical interpreting. So let's go on. So let's look at the process. We talked about the process of communication. We talked about the sender. We talked about the message. We talked about the receiver. Okay. And then feedback. This is the process of communication. Okay. Read the notes. But this is basically what it is. So once again, the sender has an idea. He encodes the message. Okay. He transmits the message. The receiver receives it, decodes the message, accepts or rejects it, uses the information, and gives the feedback. So that's the process. Okay. So once again, so let's look at this let's give this an example. Okay, a patient scheduling an appointment. Sender, the clinician wants to schedule a follow-up appointment for next week. Okay, so the clinician says, please come back next week Tuesday at 2 p.m. for a follow-up appointment. Okay, so what is the message that the provider is sending? The message is that the patient should return for follow-up on Tuesday or the following week at 2 p.m. So the patient decodes it. The patient understands that they need to return to the clinic on Tuesday of the next week at 2 p.m. for follow-up visit. So this is what they receive. The patient confirms the appointment by saying, I will be here next week, Tuesday by 2 p.m. Okay, so that's their feedback. Explaining, so let's look at this other example. The clinician wants to explain a medical procedure to the patient. Somebody needs to mute. Okay. Somebody needs to mute. There's TV going on somewhere. The clinician wants to explain the medical procedure to a patient, so in codes. The clinician uses the diagram models to illustrate the procedure, explaining each step. The message is that the patient will undergo a minor surgical procedure to remove the small growth. The code, the patient understands the nature of the procedure, its risk and expected recovery. So the patient asks questions to clarify any uncertainties, expresses their consent and all that. So we can look at the other example. So we'll move on. So common barriers to communication in healthcare. We can, okay, jargon, using complicated words, lack of attention, okay? If you're not paying attention, you won't hear noise and other distractions. Okay, light, you know, if the room is too dark or too light, it can create communication barriers. Hearing and speech problems, okay? Differences in cultural beliefs, okay? Psychological barriers, all right? Physiological barriers, all right? Patient is in pain, you know, they're in pain, they can't really hear you because, you know, they're in pain, you know? Physical barriers, okay, and things like that, and then differences in perceptions and viewpoints, okay. So again, these are self-explanatory. You have to go back and read them. I've just given you the headlines. You will have to go back and read them, and there will be quizzes on this next week. So as we said, you have to go back. You will get these notes, read your notes. I take time to prepare these notes. You have to take time to read them.
Yes, sir.
Okay. Complexities of communication in healthcare. When a clinician and the patient communicate through an interpreter, the communication process becomes even more intricate. The message must be encoded by the clinician, decoded by the interpreter, re-encoded by the interpreter, finally decoded by the patient. So this double layer process increases the potential for misunderstandings. So another thing is assumptions play a significant role in communication. People often make assumptions about others' knowledge and understanding based on shared cultural, linguistic, and professional backgrounds. However, when there's a language barrier, these assumptions can be inaccurate and lead to miscommunications. So, for example, and a GYN has finished taking a patient's history, right? And he says, please get undressed from the waist down. And then he walks out of the room. Is there a potential for miscommunication there? That was a question. In other words, you have to unmute and answer. Is there a potential for miscommunication in that?
Why should everyone? Because the doctor is giving the person to rest.
Okay. Steve, what's your response?
Oh, I would say that the doctor just said something, but without letting him know what action it should take after.
Okay. Okay. What action? What do you think the doctor left out?
Oh, he just said to him that just remove the clothes, and without saying what he should do after, like if he can put something else on it.
Okay, exactly. So Joanne, if a GYN walks out of the room and says to the patient, please undress from the waist down. So when
the gown.
Yes, it would be, but the provider has assumed that the patient understands that they should cover themselves with the gown, but they didn't say it. Okay, so that's assumption. Okay. Yeah. So for interpreters, the process of communication involves a number of things, okay? One is active listening, okay? So this is the process. So how do you manage these complexities in communication in healthcare? So strategy number one is active listening, okay? Active listening, all right? Let's pull this back. We don't need all the way there. Active listening, okay? So active listening is a cornerstone of medical interpreting. To accurately convey message, interpreter must not only understand the words, but also the underlying meaning and context. This required a deep analysis of the speaker's message, including their verbal and non-verbal cues. So the key elements of active listening: focus, concentration, and relaxation, attention to detail, mental visualization, and comprehensive analysis. So these are the things you want to do as in active listening, okay? Active listening goes beyond simply hearing the words. It involves understanding the speaker's intent, emotions, and the overall meaning of the message. This requires a higher level of concentration and analysis than casual conversations, okay? Part of active listening is to have an active memory. Active memory plays a crucial role in retaining and accurately conveying information. By focusing on the message, you can enhance your memory and reduce the risk of omissions or distortions. So active listening is different from, from casual listening, in casual conversations. Unlike casual conversations, the medical interpreter requires a high level of concentration and attention to detail. The interpreters must analyze the entire message, avoiding the tendency to focus on specific areas excuse me, of interest and ignoring others. So by mastering active listening, you ensure accuracy and various things like that. And active listening is a continuous process. Okay, so and part of this is you keep an active memory and message comprehension. You must maintain a high level of concentration and attention to detail. We've already talked about that. Okay, and then we've talked about this. It's just repeating what was already said. Let me remove this because I don't want to. Let me remove this. Just remove it. So the key points: you have to make sure maintain a constant level of focus, avoid selective listening. You immediately analyze the message. You reduce the language to meaning, break down the language into its underlying meaning, capturing the essence of the message. Avoid oversimplification. Okay. So the first thing is we said is active listening. Then the second thing is context. You have to understand the context. Okay. Understand the context. Okay, understand the context. So your first skill to help you, manage the complexities of communication in healthcare. One is active listening. Two is understand the context. Okay, understand the context. We've talked about context before. Pay attention to the details. Okay. So you're actively listening for contextual clues. Pay attention to details. Observe nonverbal cues. You question, okay, if you need clarification. Make sure you're culturally aware, okay, and your medical knowledge will help you to understand the context. So utilizing your understanding of the American medical system to interpret medical terminology and procedures. So you need one, active listening. You need to understand the context, the full context of the conversation. Okay. All right. So look at, again, read the details. I'm giving the highlights. Okay. And then 3 is then you have to facilitate the communication flow. So 1, active listening. 2, understand the context. And 3, you facilitate, okay? You manage the flow of communication, okay? Manage the flow. Let's see. Manage the flow of communication. What does it mean to manage the flow of communication? In a medical encounter with an interpreter, the primary goal of all parties is to ensure that the patient's well-being. While the clinician and the patient should maintain control of the interactions, the interpreter plays a crucial role in managing the flow of communication. Okay? All right? Okay, so let's see, there's more. What this means is that you are like the traffic cop. Okay? Who says to one stop and the other one go? Okay? Who says to the other one, Stanley, you're muted.
The red light and the green one.
Yes, but in this case, let's think about it as the yes, okay. You are the traffic light or the traffic cop who says stop, go, okay. The reason why is that if there's no traffic light or traffic cop, everybody will try to move at the same time, and what would you have? You have a breakdown. Okay, you have accident. In this case, you have a breakdown of communication. Okay, so as an interpreter, it is your role to manage the flow of communication. Stop, go, pass, and all that. Okay, and then the next thing you do is you also manage difficult situations. So let's see what actually happens in managing the interpreting session. So now we've learned about communication, the characteristics of communication. So now let's now come to the actual. Now you're in front of the this is your first appointment. You've just been trained. You've been sent to your first appointment. What do you do? So there are things you do prior to the encounter. There are things you will do during the encounter, and there are things you will do after the encounter. So there's pre-encounter, within the encounter, and post-encounter. So these are 3 areas, okay, where you will be active as an interpreter: pre-encounter, encounter, and post-encounter. So pre-encounter, what do you do? 1, you introduce yourself to the clinician. Okay. 2, you provide instructions to the clinician. So 1, you introduce yourself. Okay, 1. Okay, introduce yourself. Okay. 2, provide instructions. Okay. Then 3, you introduce yourself to the patient. Okay. As before the doctor and the patient start talking, you do 3 things. You introduce yourself to the clinician, you give your instructions, and then you introduce yourself to the patient. So let's see how this goes. Okay. So 1, introduce yourself. Clearly state your name and your role as a medical interpreter. Hi, my name is Stephen Gary. I'm your Haitian Creole interpreter. Okay. Gather information. Ask the clinician about details about the appointment and the patient's background. Is there any information that is key that I need to know about this patient that will help me in my interpretation? You may learn that this patient has cognitive impairment, or you may learn that so there's a patient who have a patient that I currently we work with. She has I think she has some kind of brain injury. No, she had some kind of brain injury which has affected her speech. So it's difficult for her to find words. Okay. She knows her birth date, but sometimes she can't say the word septum. She knows her birthday, she can write it, but she can't say it. Okay, so things like that. So 1, introduce yourself, gather information, and then explain how you will interpret. Okay. So
I got a question. So I have to introduce myself to both.
Yes.
The clinician and the patient, right?
Yes.
But the first one is the clinician.
Yes. So let's look at this. Good afternoon, Dr. Smith and Maria. My name is, and I'll be interpreting today's appointment. Okay. The doctor says, thank you for joining us. Please feel free to interpret everything we say. Of course. To ensure effective communication, I would like to establish a few guidelines. This is you're now telling the purpose. Please feel free to speak directly to Maria, and I will interpret your message. Also, it would help if you could pause after each thought or sentence to allow me to interpret. Okay. Doctor, thank you for the guidance. Additionally, I will be using the first person pronoun I when interpreting your statements, when interpreting the patient's statements. The patient's
first person.
Patient.
Yes. Statements. This will help maintain clarity and avoid confusion. Okay. Which is to say, tête me fait mal. I'm going to say to the provider, my head hurts. I'm not going to say, she says her head hurts. You understand? That's what it means to speak in the first person.
Okay.
Then the provider says, I would like you to come back in 2 weeks. You say, not literalmente.
Okay.
Okay. So you are always speaking as though it is the original speaker.
Yes, okay.
Okay.
You never can talk like in the third person, right?
Yes. You're always in the first person. No,
first.
Yes. So when you are speaking for the speaker, you are speaking in the first person. But I'll tell you but if you are speaking for yourself, you don't speak in the first person. You say the interpreter.
But or is when I'm talking for doctor.
John, you're breaking up, and we're not hearing you.
Okay, I know that I always need to speak in the first person, I.
Mm-hmm.
But when it comes to the doctor,
What's the
is it
difference?
is it I as well? Oh,
Yes.
okay.
Not he or she. You say I.
Okay.
So, for example,
Whoever I'm talking for, it's always
yes,
I.
yes,
Okay.
yes.
Okay. Okay.
um, um, you know, I'm going to examine you now. Map examine okunya. Okay. You understand?
Yes, sir.
Yes. Map examine okunya. Because the doctor said, I'm going to examine
I'm
you
going
now.
to examine you now.
Mbagadi mwen pral?
Yes.
Yeah.
Okay.
Mwen pral examine okunya.
Okay.
Not li pral.
Okay.
Okay.
Ouais.
Doctor, s'il vous plaît, on gagne une question. Doctor, please, I have a question.
Question.
Not doctor, please, she has a question. Okay. So when
Yes.
you are speaking for in medical interpreting, when you are speaking for someone else, you speak as though it is that person speaking. That is what they call first person direct speech. Okay, call that first person speech or direct speech. Okay.
Dr. Pina,
Yes.
no break. I need to.
All right. We're finishing at 8:30, so let's take a 6 minutes break. Come back at 8:05.
Okay.
All right. All right. Come back at 8:05. All right. See you. All right. So I will simplify the note, but the key thing is that before the encounter, there are three things: introduction to the provider, instructions to the provider, introduction to the patient. Okay? So let's see if let's
Doctor,
see.
sometimes I see some interpreter as a code they always pass through. Where they have the code, this code for?
What do you mean code?
Because sometimes they, when they introduce, when the introduction, they say my name is Tao Tao Tao. I'm gonna be your Asian queer interpreter today. Like, oh no, it's the doctor, it's the clinician. We always have
No,
codes.
but okay, so
yeah, you're right. Sometimes the interpreter have on code. It's probably something from the ID. Oh, I don't know.
yes, so you're right. Especially in telephonic interpreters that that work for companies, they have a code.
Yeah.
Okay, so
Oh, okay.
my name is Steve, your Haitian Creole interpreter. My code number is XX577. You know,
Oh, okay.
that makes it easy to identify that interpreter
Yeah.
for billing purposes. If they have to make an issue that I didn't like what this interpreter did, interpreter code 755. Rather than Steve Guerrier, there may be 3 Steve Guerriers. So which Steve Guerrier was it? You know, so if you have your code is your code. There might be 5 Stanley Charleses. So which Stanley Charles was it? Okay, so
I understand.
yeah.
Thank you.
And hello. Introduction to patient. Let's see, introduction to patient. Introduction to okay, let's see if we find a good one.
Can you share your screen with us, please?
Oh, sorry. Thank you. Okay, I'm trying to look for a good instruction.
Thank you.
Yeah. Okay. Good afternoon, Dr. Smith. My name is John. I'll be the medical interpreter for today's appointment. My code number is my ID number is XWN 55277. Okay. Thank you. It's nice to meet you. It's my pleasure. So that's the introduction. All right. So these are the instructions. To ensure effective communication, I'll be interpreting everything you and Maria say. Feel free to look directly at her and address her directly. If possible, could you try to speak one idea at a time and allow me to interpret after each thought? This will help maintain a clear and natural flow of communication. Absolutely, I'll keep that in mind. Thank you for guidance. Hi, my name is John. I'll be to the patient now. Hi, my name is John. I'll be interpreting for today's appointment. I'll be interpreting everything we say. I'll be not translating. Everything we say. Please feel free to speak directly to Dr. Smith. I'll convey your message. If you have any questions or concerns, don't hesitate to ask. Okay. So now let me look at where we'll make this even clearer. A second, guys. There are three things I want to point out. Scenario, introducing the interpreter. Okay. Okay. All right. Again, three things. Introduce yourself to the clinician. Provide the instructions to the clinician, and your instructions is that encourage the clinician to address the patient directly, even when you are present. Remind them to pause for interpretation. Request that they pause after each thought. Inform the clinician that you will use the first person when interpreting the patient's statements. Then
I have a question.
Yes.
It is necessary to inform the clinician that I'm gonna interpret as the first person, right?
So this is, in theory, what you're supposed to do, but this is what you're supposed to do, but in practice, like if you work for a hospital, most doctors already know. Okay? Most doctors already know. Okay? In practice, most doctors already know. Okay? But this is what you're supposed to do.
Okay. It's
okay?
like
so this is the theory. You should know how to do this in case you need to do it. Go ahead.
Okay,
Go ahead.
I got you.
Okay. And then introduce yourself to the patient. Okay. Let's see. Okay. Yeah. Okay. I think we've read this. Okay. All right. So you know the three things we're doing, right? So interpreter's introduction. Good morning, Dr. Smith. My name is, I'll be interpreting this appointment. Thank you for joining us. Okay. I'll be interpreting everything you and Maria said. Please feel free to look directly at my speaker. As if I weren't here, I will interpret your words into, and vice versa. Interpret. And so, okay. I'll clean this up before I send it. To ensure effective communication, I would appreciate it if you would speak one at the other time. Again, repeating simply. Please remember that I will be using the first person pronoun when I'm interpreting yours and Maria's statements. Okay? Understood. Thank you for your guidance. You're welcome. Let's get started. Okay. Good afternoon. My name is, I'll be interpreting. Thank you. Please feel free to interpret everything. Of course, interpret the message. It would be helpful if you please pause after each thought. Thank you. Additionally, I'll be using the first person when I'm addressing. Okay. Interpreter, I'm here to facilitate communication between you both. Please don't hesitate to ask me if you have any questions or need clarification. This is to the patient now. Thank you and all that. I'm here to help you communicate with the clinician. I'll interpret everything you say and ensure the clinician understands your messages clearly. If at any time you don't understand anything, please don't hesitate to ask for clarification. I will also ask for clarification if I'm not sure about any part of the conversation. Everything you say will be kept confidential. Please feel free to share your thoughts and concerns openly. I'll be speaking as if I'm you. So you see, I keep changing this. The reason why I keep changing this is that as if I am the doctor, because when you are speaking to the patient, you are speaking as if it's the doctor, right? So I'll be speaking as if it's a doctor. Okay. When the doctor says I, when the doctor says I will say I as well to represent the doctor's perspective. Okay. Is there anything else you'd like to ask before we begin? Okay, so this introduction establishes interpreter's role, ensures patient understanding, and creates a trusting environment for open communication. Okay. Again, to the patient, hello, Mrs. X. I'll be interpreting and greets the patient. I'm here to assist you with communication with Dr. Smith. I'll interpret everything you say so that you can understand each other clearly. If there's anything you don't understand, please don't hesitate to ask for clarification. Everything you say will be kept confidential. Your privacy is important to us. I'll be speaking as if I am the doctor. when the doctor says I, says I will say I as well. Okay, so all right, so then during the encounter, you need to have a good position for effective communication. Okay, that is if it's an in-person encounter. So your positioning can significantly impact the dynamics of the medical interpreter. It's essential to choose a location that facilitates direct communication between the clinician and patient while minimizing potential barriers. Okay. Common positions, there's a triangular arrangement. Position yourself in a way that allows everyone in the room to see each other clearly. Then there's patient side. You sit beside the patient, slightly behind, to encourage direct communication with the clinician. I will send you extra notes on positioning, okay?
Okay.
Give you a bit more information. So experiment and adapt. Try different position options to find out what works best for you and the specific situation. Remember, the primary goal is to reinforce clinician-patient relationship and avoid hindering their direct communication. So key considerations: visibility. Ensure that both the clinician and patient can see and hear you clearly. Position yourself in a way that allows you to easily access necessary documents or equipment. Choose a position that's comfortable for you and doesn't impede your ability to interpret effectively. Okay. Like I said, I will send you extra material on positioning. Okay. Now, addressing difficult situations. In medical encounters, various challenges can arise that may disrupt the communication flow. While some of these issues might occur even without language barrier, the interpreter plays a crucial role in addressing communication problems stemming from linguistic or cultural differences. So some challenges that can occur during your interpretation, there could be side conversations. The patient might refuse. The family member might interfere. There might be communication breakdown. There might be inappropriate requests, patient asking interpreter for personal opinions or questions. There might be time constraints, misunderstandings, patient-interpreter interaction. Patients want to share information with you privately. There can be language assumptions. Providers believing that they speak the language sufficiently.
Can you explain a little bit the word assumptions?
So the provider believes that they assume they can speak the language. So they assume it's an assumption.
Okay.
The patient may ask you a question. The patient may want to share information with you before the clinician arrives and things like that. So you have to know how to address these challenges. And so addressing these challenges is what we call intervening. Okay? All right? Intervening. And it's one of the most difficult challenging aspects is knowing when and how to intervene in a conversation. that is leading to misunderstandings. It can be difficult to interrupt, especially when dealing with authority figures like healthcare providers. It requires a delicate balance between being unobtrusive and asserting your role as a facilitator. Okay. So key challenges are when you're intervening with a clinician, is that the clinician is often seen as the authority figure, and that can be intimidating. Okay. So then there's a question of your linguistic skills. You need to master the appropriate language and phrasing to interrupt respectfully. Mastering the appropriate language and phrasing to interrupt respectfully can be challenging, especially for those who are not native speakers, who may not have acquired the linguistic skills in English that allow for respectful intervention. So you need to know how to do it well in English without appearing too forceful or commanding. Okay. But you also need to develop confidence to assert yourself and intervene when necessary. So don't be afraid. Okay. Remember, you are the traffic cop. Okay. So you need to, if you don't manage the flow through intervention, the communication process will break down. Okay.
Don't be hesitant.
Yes, don't be hesitant. Okay. To effective intervene, it's essential that you understand the timing, overcome hesitation, learn interruption techniques, understand your role, and use appropriate language. Focus on clarity. So, okay, to aim to clarify misunderstandings, prevent such. So when should you intervene? Okay. So as a medical interpreter, your default role is to act as a conduit, representing the patient's or the provider's voice, faithfully conveying the message from one language to another. However, there are situations where it is necessary to step beyond this role and intervene to ensure clear communication. So, what are some reasons for intervention? Okay. So, if somebody uses unfamiliar technology, so if either the patient or the clinician uses a term that you do not understand, if there's a nonverbal cue, if nonverbal cue suggests that the patient may not understand the message, there are cultural differences, or if there's offensive language. So how do you intervene? So now you shift from first person to the third person. As a general rule, when medical interpreters use the first person I to avoid he, she, said mode, and foster a direct relationship between the clinician and the patient. That's what you use. That's like we just described. You're supposed to say I. However, there are times when it's appropriate to switch to the third person to clearly indicate that you are intervening. Okay. So, so when to use the third person? When you need to ask a question or seek clarification. In other words, you are speaking for yourself, not for the patient or the clinician. Okay. When you need to provide context, when you need to provide additional information, or when you're advocating for the patient, when you need to address a concern or advocate for the patient's rights. So, for example, the interpreter would like to ask if there are any questions before the procedure, before the procedure before we continue. Okay, so now this is you asking the patient, tell the patient that you would like to ask him. Okay. By using the third person, you clearly signal that you are intervening and that your statement is separate from the ongoing conversation between the clinician and the patient. This helps to avoid confusion and maintain the clarity of communication. The second thing is, when you intervene, you shift from the first person to the third person. 2, you ensure transparency. What that means is, you keep both the clinician and the patient informed about your actions and reasons behind them. So let me indicate what exactly that means. So transparent communication simply means that one monolingual knows what you're discussing with the other monolingual. Monolingual means speaking the person, you know what monolingual means.
Yeah, the person for you interpret on this one language.
Okay. For example, if the provider uses a term that has no linguistic equivalent in the target language, let the provider know that you will need to explain this term. This way, the provider understands why you're speaking for so long. Okay. So, for example, the clinician uses a medical term that the patient is unfamiliar with. Explicitly inform both parties about your intention to explain the term. This transparency helps to avoid confusion and maintains the clarity of communication. The provider will understand why you're speaking for so long. By informing the clinician of your intention to clarify the term, you are maintaining transparency and ensuring that both parties understand the reason for your intervention. This helps to avoid confusion and maintain a smooth flow of communication. Okay. The clinician uses a medical term and the interpreter believes the patient may not understand. Excuse me, doctor, the interpreter, now you're speaking in third person, you're not saying I. The interpreter believes the term hypertension may be unfamiliar to the patient. Would you like me to explain it in simpler terms? By explicitly stating your intention to explain the term, you are providing transparency and ensuring that both parties understand the reason for your intervention. Give me a second, guys. I have a meeting at 8:30. Let me just tell them I'm running behind. Okay. 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 All right. So frame your intervention as a suggestion, not a directive. When you believe that a course of action would benefit the patient or the communication process, present your suggestion as recommendations rather than directives, accompanied by clear explanation. This empowers the clinician to make informed decisions while acknowledging your expertise and insights. So the interpreter believes the patient may need more clarification about informed consent. I would recommend that you explain the concept in more detail. Okay? You're not giving them a directive. It's a suggestion, it's a recommendation. Okay? Example 2, in this patient's culture, family support is highly valued. It might be helpful to involve the patient's son in the conversation before sharing any difficult news. Okay? Again, it's a suggestion. The interpreter believes that the patient may need more clarification on informed consent. Would you be willing to explain it in more detail? Okay. Okay. We will need to perform a laparoscopic cholecystectomy. Interpreter pauses and directs Dr. Smith. Please, excuse me, doctor. The interpreter would like to ask what a laparoscopic cholecystectomy is. I believe it might be helpful to explain this term to Maria in simpler terms. Okay. Certainly, it's a minimally invasive procedure to remove the gallbladder. Turns to the turns to Maria and says, so in this case, the interpreter is now speaking in the third person. Okay, so it's kind of because he's saying Dr. Smith is proposing a minimally invasive to remove your gallbladder. So So the interpreter may have said to this patient before this, saying that there's a word that the doctor used that I didn't quite understand. I'm going to ask him to explain. Okay? That interpreter didn't understand. I'm going to ask him to explain. So then you then so let's make this I am. So you're speaking for the interpreter now. I'm proposing a minimally invasive surgery to remove your gallbladder. Okay, because you're back to you finished clarification. Now you go back to the first person speech again. Okay, not Dr. Smith. Okay, so in this case, Maria, from a culture where direct confrontation is avoided. Okay, suggest a treatment plan that seems hesitant to accept. Dr. Smith, are you comfortable with this treatment plan? Maria hesitates and avoids making direct eye contact. Interpreter observed Maria's hesitation. Excuse me, doctor. The interpreter believes, let me change this eye. Believes there might be, so now you're talking for yourself, so now you have to speak in the third person. There might be a cultural difference at play here. In Maria's culture, it's common to avoid direct confrontation. Her hesitation may not necessarily mean disagreement. Thank you for pointing that out. Maria, please feel free to express any concerns or questions you may have. Okay? So, and on and on and on. So, so this is how it goes. You introduce yourself to the clinician, you give your name, find out the goals of the appointment, say that you will interpret everything and ask if anything is unclear. To the patient, you give your name, say you are the interpreter, say you will be helped by interpreting everything about, assure the patient of confidentiality, okay? And then you interpret everything with 100% accuracy, and this is what you do, okay? And then debrief with the clinician. We'll talk about this. I'll send notes on debriefing. Make sure your patient has that information that she needs before you leave. All right, so that's the end of today's lecture. I will complete these notes, send them to you, and then we'll have a quiz on this. The anatomy exercise for this week, this is anatomy. This is our anatomy for this week. Let me, what is anatomy for this week? Anatomy. Anatomy and physiology, okay. Okay. So let me put this again at the end. So this is what we're doing this week for anatomy. So, so we're going to compile a list of comprehensive list of essential terms relating to the integumentary and immune systems, as well as common infections and vaccinations in both English and your target language. So I will send you the worksheet. Okay.
Okay.
All right. This lecture, Steve, for the lectures you missed, they would be on YouTube, and I will give you instructions. I'll give all the instructions on how to access the YouTube. If by tomorrow night I haven't sent you the instructions, please send me a message.
Okay, teacher. Thank you.
Yeah, and Stanley, let's talk sometime tomorrow, okay?
Okay.
Yeah, let's specifically talk tomorrow. Okay, so make sure please reach out to me tomorrow, Stanley.
Tomorrow, by what time?
Just call me anytime, and if when I get your call, if I'm able to answer, I'll answer. Otherwise, I'll let you know when I'll get back to you.
Okay. Thank you.
All right. Have a good night.
Thank you. You too, sir.
All right, thank you. You too.